everyone, and welcome to Incident Prevention's Utility Safety Podcast. I'm Kate Wade, the editor of Incident Prevention Magazine, and your host for this episode. Today, I'm sitting down with Jenny Lavin, the founder and CEO of Union Care Solutions, a nonprofit organization dedicated to improving mental health and wellness in the union electrical community. In this episode, Jenny and I will explore the industry's current mental health challenges, what prompted her to launch Union Care Solutions, the services her organization provides, and where she sees the nonprofit headed in the near future. So, without further ado, I'd like to welcome Jenny to the podcast. Jenny, thank you so much for being here.
Hey, Kate, thank you so much for having me.
It is so good to see you again.
You
So let's kind of jump right in. Will you tell me and our listeners, maybe give us an overview of your background and kind of what prompted you to found Union Care Solutions?
Yeah, so I've been a union wife for over 20 years. My husband's in the union. I have two sons that are now in the union as well, and so they're fourth generation.
And that's IBEW, right?
IBEW, yes, that's IBEW. And so my whole family is in the union, so that I've been around in this community for a very long time. And so what prompted me to start Union Care Solutions was a few years ago. We started to notice some of the challenges that were happening within the industry. And so when I started to hear about the challenges and knowing that my sons are coming into this trade, and also knowing the families that are a part of the trade, and there became kind of this disconnect because it was something that was really news to me, and there weren't a lot of resources that were available. And the conversation, we really just started to have these types of conversations around mental health and within the trade. And so I wanted to be part of the solution, and I wanted to be able to bring the resources that I started to find that were available. I mean, it was kind of a treasure hunt. These weren't things that were on the surface easily accessible. And so I began to look to see what was available and to try to see, okay, what would fit within our community and what would be helpful for us. And so it kind of has just grown from there.
That's so good. This is obviously such a challenge in our industry, mental health, suicide. Are there any statistics that you can provide for our listeners to kind of give context to these challenges, particularly in, electrical, utility, and construction?
Yeah, so one of the major reasons of why I started this was because of the statistics. When we started to look at when you think of like on the job fatalities, there's a lot of push for safety. But at our home local, we had 22 drug overdoses, 19 suicides, and 5 on the job fatalities. And so when you look at those numbers, you see there is a huge disconnect, and it's right on course for national averages, where you're 5 times more likely in the construction industry to be affected by like a mental health condition than you are an on-the-job fatality. I think one of the other statistics is that 30% of construction workers report psychological distress. And so a lot of times they're looking to drugs or alcohol to mitigate those problems. And so they account for 17% of the overdoses for the working population, while only making up 8% of the workforce. So it is a huge issue within construction. The numbers are there. What was happening in our own community, that was what really hit me. But then when I started to leverage that against some of these national averages and these other things that were happening just around the country, it all tracked. And so that was what was alarming to me.
The numbers that you referenced, the statistics in your own community, is that like an annual number? Was that over a certain?
So that was over in the last 5 years. So that was it. These were our numbers that we kind of gathered within the last 5 years. And so a lot of times when somebody, when there is an on the job fatality and then there's safety stand downs and there's a lot of attention brought to that, but there isn't so much attention brought to some of these other things. And a lot of these things, people, they struggle silently, and there's a lot of stigma around these conversations, and most of us don't really know what to do or have conversations around it or with somebody that might be struggling. And so finding out like where your place in that conversation has really been something that has been kind of a focus on, how do we get those trainings and the education out there so that the people can support each other.
Well, so do you have like a mission statement or something, like the catchphrase, the tagline? Because I'm curious about like what the overall mission and vision is, and then what kind of services you're providing or help the organization achieve those goals.
Yeah, so our mission is to bring advocacy and awareness of mental health issues within the union electrical trade. And so for me, the mission for me is to bring advocacy and awareness of mental health conditions within the electrical trade. And so I do that by offering trainings. I provide mental health first aid and vital cog suicide prevention in construction. I do a lot of advocacy work and also providing resources. And so my goal is for Unicare Solutions to be kind of a hub where people can access information within the industry or find articles and resources that could help them do their job. There's a lot of people within the trade that are in safety or what have you that are out there doing work as well and are passionate about it. It's just there's so much information out there. It's hard to kind of weed through what might be applicable. And so that's kind of been my focus nowadays is to sort of go through that. And so that I can help connect people with those resources.
Well, and I think you're based out of California, correct?
Yes, yes,
Okay.
yes.
So tell me, do you do a lot of local stuff? Are your services national? And it sounds like they're for strictly people who are IBEW or families, something along those lines.
Yeah, right now I do serve my local community. And we operate out of this model for Unicare Solutions. It's train, mobilize, and deploy. And so the idea is that we are offering mental health trainings that we mobilize within a peer support network. And then the deploy is the critical incident stress management. So there currently isn't a lot of aftercare for the guys in the field, for the men and women that when it comes around fatalities or on the job incidences. And so utilizing critical incident stress management has been really effective in creating space for people to process the things that they've seen. But one of the things that is really important is that, if I can do this in my community, you can do it in your community. And so I've really tried to gather resources that are broad, that are nationally recognized. These trainings have train the trainer option. So anybody really can do it. And so I do enjoy training, and I do think I have some really great effective conversations. But what I think would be really rad is if you had guys that were in the field that were able to take these classes, it's either supervisors or linemen or groundmen or even apprentices, right? Anybody that is there that they're able to now teach a class and be able to connect with their peers in honestly a much different way than I would, right? Which is, I think our industry, just like a lot of different types of construction industry, is kind of like for us by us. There is like a group mentality, and sometimes they'll only listen to each other, and that's okay, right? And so I think being able to cover our bases where we can get people that are in the field trained for some of these and help them become, mental health, first aid responders, so that if somebody is struggling, in the field, or they're having a problem that they can't quite figure out on their own, or they're going through a divorce, or they're having trouble at work, or they're not able to speak up, like that there are other people that are trained in this and that are able to go through some steps and get people connected to resources. So I really do advocate a lot for that is getting this information out there so that other people can, be where they're at, right? Because we all have our own unique circles of influence. And so if people can get trained and they know what the resources are available and they feel supported, and then when there is a crisis, that there is a team of people that can go out there and debrief the crews when there is an incident or a fatality. I think it's really important.
Well, yeah, it sounds like, in an ideal world that every union local or at least regionally, there would be someone, who at least part of their job is dedicated to this kind of thing because, I know a lot of organizations have like employee assistance programs and things like that, but what you said about for us by us, it's sort of the incident prevention model. Our magazine is all contributors, people who work in the industry who are trying to, help each other by sharing education. I think when somebody knows the exact kind of struggles that you face every day because of your job and things like that, and it's somebody they know, it's not like some number they have to call and a person that they've never met that they have to talk to. I think it could be super helpful. And yeah, I would really encourage everybody to try it out and that train the trainer kind of thing that you have going on where, you have a scalable model, like people can learn from you and, have your assistants to help them help other people, which I think is just awesome.
Thank you. Yeah, and a lot of people I think know the issues, right? A lot of the people from the trade, they know what they go through, so they're familiar with that. I think what they don't know is the resources that are available. There really are a lot of resources, and even across the IBEW and within our local utility, there are things that are happening that not everybody knows about. And so a lot of these organizations have really taken it upon themselves between, you have NECA and you have the IBW, and even at some of these high levels, these conversations are being had. And so the trainings and resources are there, and there's a lot of really great people that are working to figure out, okay, how do we get it from here to out there? And I think it is just the awareness that it isn't just a, hey, call the EAP, right? Which EAP is a resource and people do find a lot of value in that, and I think it's very important. But I think what's most helpful is when you have somebody like a brother on the crew that maybe has gone through what you've gone through, and they're there. They're like a real person next to you that is saying, "Hey, like, I noticed that you're off today. What's going on?" Or, "I know today was a rough day at work. I just wanted to check in to see how everything was going." And so, I always say the little things are the big things. And so sometimes just checking in and being aware that this job is rough and it affects us all differently, and that first line of defense is each other. The first line of defense is your crew. People are on the job more, and they spend more time, with their work, crew than they do at home sometimes. And so, if you can tell if a guy's off, or sometimes you hear that maybe he's going through something. And so just equipping people with those resources, and that training is super important.
Well, so I'm curious, are you a one-woman show? Do you have assistants? Because, during our relationship, since we met each other and started talking, you seem to do a lot of the work, so I'm curious about what kind of support you have.
Yeah, so I do have a board, and it's made up with several line wives and other union representatives, and we currently we are an all women board, and these are all women that care very deeply about the trade. They have husbands in the trade, they have family in the trade, and so I have a mental health professional that I work with for a lot of the content as well. And so we meet and we discuss things about, what would be best on how to put things together and how to get this information out there. So currently I do the trainings on my own. I'm working on getting some extra trainers as well. But my heart really is to be a very small part in a large conversation. I think that there are a lot of people that have such a great heart and desire to help this community. And so those people, I seem to be able to find those people. And so if I can help connect them to resources and getting them trained, that's kind of my goal. And currently, I'm working with our local union to get mental health first aid off the ground. We have a pretty robust critical incident stress management team that has been deployed to several incidences. And I think that the community finds a lot of value in that. And so I get to work with a lot of really great people. And even at our utility, there's people that are doing their job. So that's what's kind of cool is because of the work I do, I get to see the work that other people are doing. And so it's really encouraging. And so that's kind of my goal is to say, hey, look at like, you're not alone. This is if it can be done at this utility, it can be done at that utility. If it can be done at this contractor, it can be done at that contractor, right? If I can do it here at our union, you can do it at your union. And really the goal, like ultimately for Union Care Solutions, to sort of create that table where everybody can bring all the resources, right? It's just like kind of like a potluck, right? Like everyone brings their food to share and it's like you can make your own plate, right? These are the things that are here. These are the things that are vetted throughout the industry. These are the calls, these are the organizations. Come see what's available and find out what works for you, right? Because what might work for one utility might not work for another. But that doesn't mean that you can't have a peer support or a crisis response team, right? It's just figuring out where do we attach it to the existing structures. And that's really important to me is not trying to reinvent the wheel, but really just trying to have this be part of the safety conversation, this like psychological safety component, and just develop the conversations around that. Because I think it's not talked about and we're really not taught what does that look like? What does a psychologically safe work environment look like? Why is it important? How does it affect people on the job? How does it affect people at home, right? Or how do things at home affect people on the job? And so the more conversations that we can have around this, the better I I believe the better equipped individuals will feel when they are in a situation where somebody does need help.
Well, and I'm just thinking, the peer support part of it. It's like, wouldn't it be awesome if, every local had somebody who was vested in doing this kind of work, this kind of training and support for their employees, but then they could also have, if all of them had that, that's its own peer support group. So now you have people at every other local, to call up and say, hey, what are you doing? And what are you doing? And how do we support each other? I just like when you talk about the future, I can just see how this,
Yeah.
in the right conditions could fully grow and blossom. And um yeah, and I was kind of going to ask you anyway, like, what do you see happening over the next, 5 or 10 years? Where are you going? That sort of answers my question. But do you have other objectives or goals or things that, like you would like to see happen? I guess moonshots.
Yeah, for me, like you said, I think there are a lot of things that a lot of the unions are already doing. It might not be called right peer support but they have committees or peer support can look very different and all across, especially, specifically the IBEW, there are unions across the country that have their own peer support programs or safety peer-to-peer programs or committees or things like that. So there's a lot of things that are already happening. And I think where I would like to grow Union Care Solutions is to be sort of a hub of like what is happening. So if you want to know what's happening in California or what does New York have and how do they run it, right? There's no sense in really reinventing the wheel. There's a lot of great things that are already happening within our community. It's just getting the word out and letting people know that this is what they're doing. How do we tweak it to fit our particular demographic or community and our own needs? And so I would really like to see Unique Care Solutions just develop a really great resource hub for people to go through and to kind of an easier, more kind of digestible way to get through some of this information that's out there, because there are a lot of great organizations like the CPWR, like they put out so much great content. It's just who's going to have the time, right, to read through 16 pages of a document. You have to be really committed. And so it's like I share those resources, but it would be great to also be able to pull from that.
Let's note.
Yeah, and to make it easy for, well, and because this is my job now, but it's not everybody's job, right? And so when you have people that are in the field, they need something that's quick and accessible that they can read at a tailboard, right? Or talk about in, 3 minutes or 5 minutes, right? And so to be able to give them content where they're able to do that and to support them where they're at is really important. I mean, my biggest dream is to see crisis response teams nationwide and to be able to develop a network so that when there are things like storms, fires, and when these guys go do that work, that we are aware that there are CISM trained linemen that go to these things, and to be able to know that if the guys see things, because they do see some pretty horrific things when they're out there, and it's not talked about, and it's not talked about. And a lot of guys end up stepping away from that type of work because of that. They carry sort of the stories and the images that they've seen when they're out there, and it's really rough. And then they have to come back and, business as usual. They come back to their families, and there's not a system to process that. And critical response team and the critical incident stress management really does a great job of offering a space to do those debriefings. So I would love to see that across the nation, that becomes a standard practice when we do see those teams. And then I just really enjoy seeing how it grows, and if I can, it's like I get to see what our community is doing, which is a lot of really great things. So if I can share that and help bring hope to the industry, that they're not alone and that there are resources and that there are solutions to some of these problems, and that there's a lot of people that are working hard to help the industry. And so just to share that is kind of like my goal.
Well, thank you for bringing up the part about, the things that sometimes people see on this job, because I think that's not a thing that's talked about. It's not something I even hear much about. And I mean, when we think about soldiers who go to war and they see things, we have the VA, and we talk about PTSD and things like that, but that doesn't necessarily, translate to the utility industry. And it's equally as traumatic, I think, to see some of the things that these people have seen more than one time. So I just commend everything that you're doing. And I think that you're so on point and in touch kind of with your target demographic. But one important question I have for you, though, you guys are a 501c3, right?
Yes.
Yeah. So tell me, if we want to find out more and we want to support you, how does that happen? What can we do?
Well, I mean, I have a website. It's unioncaresolutions.org. So you can reach me that way. You can donate through the website. And a lot of the trainings I offer, I do offer them for free. That's a really important thing for me, because it's not something that, especially in my community, like I said, this is my community. So a lot of these times, these are people that I know. These are, colleagues that I've known for years. And so I don't want there to be a hindrance in this. I really am trying to build it where if things do cost money, that the companies are paying for the seat time. That's really the most expensive part. I mean, money is an issue, right? It's business. And so I think that's something that has to be talked about. And so, but I do believe, again, like that picnic table, if we all bring our resources, this is something I can do. I have, agreements, with the union does stuff. They bring their resources. If the contractors bring their resources, that we're all able to get this done. It's not something that we're having to have an outside, right, organization or company or consulting firm come in and charge a bunch of money to figure out and work, that we're really invested in our own, and we're having our own community do it for each other. And this stuff, it isn't really talked a lot about, right? Because like you had mentioned, like with all the things, like these guys are, sometimes zero responders. A lot of times when it comes to the electrical trade, they are on the job before even sometimes the first responders, and their job is to make the scene safe so that they can do their job. And so with that, they're rolling up on accidents and things like that before even medical help gets there. And so those things aren't really talked about. And so I think the more that we address that, the better we'll be at finding solutions to help each other. And it really is just bringing that awareness.
Well, so Jenny, we've talked about a lot of things here today, and I think you're doing really important work. And so I just want to ask you before we close out this episode, is there anything else that you want to mention, talk about that we haven't covered here that you think is important for people to know?
Well, I just think that it's important for people to know that they're not alone, and that the work that they do matters, and that there are resources, and that there are a lot of really great companies and organizations whose sole purpose are to bring these resources, within the trade, and that what you do matters, and just showing up and being human, and realizing that every single person you come across is going through their own battles. They have their own story. They have their own things that they're bringing into the job. And that if we can pause and maybe just allow space to think about things a little bit differently, and be open to that, and be open to making things better than it was maybe when they went through an apprenticeship or when they were a young lineman, right? That the goal is to recognize that the work is rough, but that we have a really great community. And that's why I love the IBEW and the community that I work with, is because it is a brotherhood and it is family, they show up for each other, and that's the biggest thing that I see, is that these guys show up for each other when there is a problem, or if there is a fallen lineman, the way that they show up for families years after. Like, this is a great community. These guys have big hearts, and I think it's just equipping people with some new information, and maybe just, risking the risk of being a little uncomfortable sometimes, and sometimes we do have to look at ourselves and do the work internally, and it has such a great return of investment. And so that's what I would say, is that there is hope, and that people are not alone, and that there are people that are willing to show up for one another, and just to be one of those people, right? Just be one of those people that is willing to say, you know what, I'm willing to learn something different. This is uncomfortable and it's a little out of my wheelhouse, but if it is the difference between somebody silently struggling and feeling supported, I'm willing to do the work.
Yeah. And sometimes that's the best thing, is to make yourself uncomfortable. I think that's when we get the greatest returns. And to make yourself uncomfortable for, the benefit of someone else and their family, that they are still alive and in good health and happy. I mean, that's everything. I also just really want to thank you for being here today. I so appreciate it. I just want to let our listeners know once again, Jenny's website, the website for Union Care Solutions, is unioncaresolutions.org. We've also posted her contact information on our website at utilitysafety.podbean.com. And so until next time, stay safe and be well. The views, information, and opinions expressed during this podcast are solely those of the individuals involved and do not necessarily represent those of Utility Business Media and its employees. It is strongly recommended that you discuss any actions or policy changes with your company management prior to implementation.